Consumers spend around $2 billion a year on Botox for cosmetic reasons. Yet one of the most frequent questions patients ask is where and how can it be used for a more youthful appearance? One of our viewers came to me looking for answers, so I turned to a plastic surgeon in this week's Ask the Doctor. Larissa wants to know, what is the difference between these facial fillers she hears about and then things like Botox and Dysport?
It's a good question. I hear that a lot. They're both considered what we call injectables, so you're using it in the office. It's something that's really an outpatient kind of thing. You just come, get the treatment, and leave. But there's a pretty distinct difference. So Botox, Dysport, Xeomin, these are all products that we call neuromodulators. And what they really do is that they're more responsible for treating certain lines that we call active or expression lines. Right? So for example, the lines between the eyebrows when you frown, or across the forehead, or the crow's feet, these are caused by muscles that are contracting. So when you sleep, those lines look better. But during the day, when you're animated, they're more apparent. That you can treat by using Botox or something in that family of medicine to help relax the muscle. And the point is, people say, was that going to make me look frozen? Well, no, the point is you want to use it judiciously and use it in an area that's causing a problem. So if you're scowling all day long, not because you're upset, because you just happen to squint when you look at the computer or when you're on the phone, well, that's something that over time is going to make you look like you're frowning all day long, even when you're not. So,
and then what are your other choices for fillers?
So that's a neuromodulator, Botox. So fillers, on the other hand, are something that are really meant to help plump up certain parts of your face. Okay, so for example, the folds around your mouth, and the corners of your mouth, and your cheeks. So these are all things that as you get older, you lose some volume, and that's where something like Juvederm or Restylane, these fillers can help actually improve and volumize the face.
Hopefully that'll answer a lot of questions, because I know people get them confused all the time, don't they?
Absolutely. So it's not so much that Botox replaces Juvederm or vice versa. They're used in conjunction to treat two different problems.
For the so-called liquid facelift.
Correct. A liquid facelift is just a marketing term, but essentially what it means is you're able to rejuvenate aspects of aging just using Botox fillers, and do it in the office on your lunch break and go back to work.
All right. Thanks for your help.
Sure. Thanks.
And that
this
was
newscast
Dr.
is brought to you by
Chili helping us out there. We appreciate that. You can contact me through Facebook or Twitter if you have a question to ask the doctor. On Facebook, you can find me at Melissa Wilson, Fox 26. Coming up at 8, we're asking Dr. Chili about the best ways to protect your skin from the sun's harmful rays, especially as spring approaches and you begin to spend more time outdoors.